Good evening and welcome. My name is Ray Jayawardena. I'm the Harold Tanner Dean of Arts and Sciences at Cornell University. I'm delighted to welcome 4 leading science and health reporters to our panel tonight on covering COVID, how journalists tackled the biggest science story of our time. This special event is presented by the College of Arts and Sciences Distinguished Visiting Journalists Program, which aims to recognize excellence in journalism and provide opportunities for select journalists and the Cornell University community to engage with each other. In addition to events like this, we also host journalists on campus for extended visits. The program launched early last year with Mark Lacey, now Assistant Managing Editor of the New York Times, as our inaugural visitor. This fall, we will welcome Los Angeles Times writer and Pulitzer Prize winner Molly O'Toole, who covers immigration and national security. Molly plans to be on campus for the entire semester, teaching a course for our undergraduates and engaging with our faculty and the broader community through a variety of venues and events. The program is supported by a significant endowment from Jan Rock Zubro, class of 77, and Barry Zubro, as well as additional gifts from Jay Brannigan, class of 72, Rose Gutfeld Edwards, class of 78, and Dr. Guinevere Griest, class of 44, Fund for Public Engagement. We are grateful to the Zubros and our other generous donors for making this exciting and impactful program possible. We are also grateful to our advisory committee members who have helped us shape the program since its launch. They are Jessica Chen Weiss, Associate Professor, Department of Government, Joel Molina, Vice President for University Relations, Nolive Rooks, the W.E.B. Du Bois Professor of Literature in Africana Studies and Research Center and Director of the American Studies Program, and Stephen Strogatz, the Jacob Gould Sherman Professor of Applied Mathematics. If you're interested in learning more about our Distinguished Visiting Journalist Program, I encourage you to visit the college's website. On to tonight's program. The pandemic has highlighted the critical role of journalists in our society, as we've depended on their reporting on matters of life and death on an extraordinary scale, at a time when the world has been gripped by uncertainty, fear, and loss. They've become essential workers themselves, taking us inside hospitals, dealing with dire situations, bringing us important guidance from health professionals, battling misinformation, and interpreting complexities of virus mutations and vaccine developments. We are very, very grateful for their vital work, and we look forward to hearing from 4 terrific journalists on the front lines of pandemic coverage this evening. Our moderator for this panel is Faye Flam, Bloomberg opinion columnist and host of the podcast Follow the Science. Her podcast follows the winding and sometimes contentious and politicized path of science during the pandemic. So this is a topic she has considered deeply. I first met Faye way back when she was a staff writer for Science covering physics and astronomy. Later, she worked at the Philadelphia Inquirer, where she covered everything from criminal forensics to human origins to statistical errors in science. Faye, it's great to see you again. Over to you.
Thank you, Ray, for that great introduction. I've been asked to say a couple of things about my coverage of the pandemic. So I'll start by saying I went from being a reporter and feature writer to being an opinion columnist, but being an opinion columnist is actually very similar to being a reporter. I still go out and do research and talk to experts, but at the end of my columns, I draw a conclusion, and I also have a little more freedom in choosing topics that aren't necessarily the news story of the day, but might be trends or ideas or something that I want to interpret differently. So I started covering the pandemic in January of 2020, starting with a column on why the U.S. needed to do more to prepare for the coronavirus coming here, and pretty much continued to cover it continuously for the last year and change, because it really was the health and science story to cover, and there were just so many different developments and things that people wanted to know about. I also do a podcast called Follow the Science. In theory, it could be about all kinds of science. It's part of a fellowship that I have from the Society for Professional Journalists, and my emphasis is on medical misinformation, but I for at least for the time being, most of the relevant medical misinformation problems center on the pandemic. I do an episode every week. I'm up to episode 20. And we have some great panelists. I'm really excited to be introducing them. We have Apoorva Mandavilli. She is the New York Times reporter focusing on science and global health. She came to the Times fairly recently, was actually picked up specifically to cover the pandemic in May of 2020. Before that, she was the founding editor-in-chief of Spectrum, which is an award-winning news site on autism science. And I have been following her coverage very closely from before she became a staff writer there, because she was doing some great freelance stuff for them. Okay, and we have John Cohen, who is a former colleague of mine. He works at Science Magazine, and he is also a journalist who has specialized in infectious disease reporting for more than 30 years. He's done a lot of great reporting on the AIDS pandemic before this pandemic, and he has written for The New Yorker, The Atlantic Monthly, and The New York Times, the New York Times Magazine. And we also have Jason Bobian, who covers global health and development for NPR. Jason was actually in Hong Kong at the beginning of the pandemic and began covering it back before the disease even had a name. He was called back to the US in March, but has been covering the pandemic ever since. And he focuses on the way that the pandemic affects low and middle income countries. He's also been a correspondent in sub-Saharan Africa, where he's been in 27 countries and has been based in Mexico City as well. So I think these panelists have a really great mix of backgrounds and interests, and I'm excited to hear about what they have to say. So I will hand it off to each of the panelists, which we start with Apoorva.
Thank you for that lovely introduction, and it's a pleasure to be here. I guess I'll begin with how I got started doing this. You mentioned that I was brought on to the New York Times to specifically cover the pandemic, and that's true. I actually wrote my first story in January as well. I went to a holiday party that the Times Science Department had. I was just a freelancer, and I talked to them about the fact that kids didn't seem like they were getting very seriously ill. And this is something that I knew from having covered SARS and MERS before. So that was the very first story I wrote. And they quickly pulled me into their carousel of coronavirus coverage, as they put it. And before I knew it, I was writing 2 stories a week even sometimes, and I had a full-time job. So it became very quickly unsustainable. And so they asked me to join, and it wasn't, completely out of the blue, because I had been writing for them for a couple of years already, and what I wrote was mostly about infectious diseases. And before I started Spectrum, I also did a lot of reporting on HIV and TB and malaria and infectious disease in general. So this for me was a return to infectious diseases, which is my passion, but also it was a challenge in some ways, because I was changing jobs in the middle of a pandemic. I have yet to see the inside of the building that I used to work in, other than to move my stuff out of the office. And then I've never set foot in the Times building since this. I mean, I've been there as a freelancer, but not as a staffer. Fortunately, I did know some of the people from having been a freelancer, but otherwise, starting a new job in the middle of a pandemic is not something I would recommend. It can be really quite challenging. But, I loved what I was doing. I love what I'm doing. It was like compressing everything you need to learn about a virus, which normally would take 10, 20, 30 years, as John knows. We still are learning things about HIV, and compressing all of that into 1 year. So that involved a lot of reading of preprints, research hot off the press, and having to exercise scientific judgment constantly, and also finding experts in a field that was really brand new. So I think it's really become a little bit more slower, I guess it would right now. But for the first 9 to 10 months, I would say there was not time to just take a breath even. So I'm very glad that it's slowing down a little bit. Some of my favorite stories that I wrote over the year are actually not even just hard science stories. They're science stories that intersect with politics, about how the CDC documents were being doctored by the Trump administration against the wishes of the scientists who worked there, or about why the WHO was so reluctant to acknowledge that the coronavirus can be transmitted by air indoors. So I've covered the kind of range of coronavirus stories. So I'll stop there.
Well, yeah, they've been great stories. I've been reading them very diligently, and it's been helping me keep up on new developments. So let's go to John Cohen.
Thanks, Faye. I, as you mentioned, I've been doing this a long time, and my specialty is outbreaks and infectious diseases and vaccines and immunology. So I've joked many times that the pandemic was sort of made for me. And I started covering it on January 8th, and it took over my life. And I basically feel like I had a fever covering this. Unlike Apoorva, I work on a rowboat. She works on an ocean liner. we have a smaller staff than the New York Times, but we very aggressively try to compete with the New York Times and everyone else. And I'm fortunate to work with a really talented group of writers and editors who are based around the world. So we essentially were doing 24/7 coverage, because whenever I would go to sleep, somebody was waking up somewhere in the world, and we were tag teaming a lot. And a lot of people I work with also cover infectious disease regularly. So we hit the ground running. And interestingly for me, many of the people at the front of the response in public health and in science were HIV researchers who I'd worked with for 30 years. So I knew the community very well. And to this day, the HIV field, I think, has played an enormous role in helping understand the disease and solve the medical problems. I've covered every aspect of it. I do still specialize in vaccines. It's my first love, but I've covered treatments aggressively, and also I've covered the epidemiology. I've struggled to cover China because China is extremely difficult to communicate with, but I have managed to interview key scientists in China over the course of the pandemic when they're allowed to speak, and I'm proud of that. And I even did a large story about China's COVID-19 vaccine industry, where I got everyone to speak with me over time. It just took a lot of doing, and I was able to, after much lobbying, convince the researcher at the center of the origin controversy to speak with me and address some of the questions that were at the top at that point. This pandemic has required all of us to adjust and adjust and adjust, and I've described it as playing the accordion. And we open up, we close, we open up, we close, and there's been so much confusion and so much uncertainty. And I've felt as a journalist useful, very useful, because those of us who cover science regularly know how to sort fact from fiction, and we know how to cut through the fog of outbreaks and epidemics. There are always many unknowns with an outbreak or an epidemic. This one's no different. And there are always debates about origin. There are always debates about the epidemiology. How many people are infected? How is it spread? This stuff, there are always issues about making treatments. There are always issues about vaccines. There are always issues about the pathology. How is the disease actually caused in the body? So the team I work with, I felt very fortunate that they were extremely critical in parsing information in real time, which is the hardest thing to do. And then we also found this flood of new infectious disease reporters, and the journalism community responded to this from every media outlet with incredible vigor and tremendous reporting. I mean, it's humbling to me how we as a community of journalists have covered this, and I remove myself from it. I need not have existed. The science need not have existed. The coverage has been spectacular. And it remains tremendous every day to wake up and see what other journalists are doing. I'm frustrated that I can't break more stories because I've long prided myself on not being scooped because I focused on such obscure stuff that I had no competition. And so it's been a relearning for me of how to live in this environment where everyone does what I do. But I, by and large, am really proud of other journalists and other organizations. And I think that we deserve a clap on the back for something that's really hard to do, and that's to put out accurate information in real time about things that are life and death matters. So I'll stop there.
Wow, thank you, John. I would say that your coverage and the coverage in science has been essential to me because it's so well thought out at a time when there's so much rushing and things in the, that have to get in on deadlines, that getting that, really thoughtful take on things from science with the kind of detail you need and really smart coverage has been part of my essential reading.
Well, that's good to hear. I think one thing that happened during the pandemic is we made it clear to many more people that we're not a bunch of pointy-headed nerds. We are writing for the public. Our stuff is meant to be as clear and transparent and easy to understand as what any other media outlet does. And we've often been sort of tagged unfairly with this sort of trade publication or too meppity nerdy. And yeah, we do go deeper into detail at times, but by and large, we're writing for the same audience.
That's absolutely true. I've written for the Philadelphia Inquirer and for Science. I wrote pretty much the same way and at the same level. So I think that is important for people to know. Science is also a journal, and there are scientific articles in the back. But
no one understands those. Yeah.
Nobody reads it. Those are a whole different thing. But the front part is written by professional writers who are doing the same kind of journalism that any science magazine would do. So let's talk now to Jason. Jason, let's hear a little about your coverage of the pandemic.
Yeah, I mean, for a lot of people, the pandemic for me sort of changed everything. And this has been a year unlike any other year in my entire career as a journalist. Prior to COVID, I was traveling regularly. I am in this role that I'm covering global health, and particularly from low and middle income countries. I spend a lot of time on the road. And the way that NPR's coverage is structured, we have domestic health reporters who cover domestic health issues, and then a couple of us that cover sort of global health. And when this hit, I actually was in Australia covering the Australian wildfires over the New Year's into the beginning of January of 2020, and then started hearing about this sort of strange viral pneumonia in Wuhan, and ended up going to Hong Kong. We couldn't actually get I tried to get a visa into China. I couldn't get a visa into China. It was actually a very difficult moment for us because we had Frank Langfit, who had been our Shanghai bureau chief, had left to take over the London bureau. And this poor guy, John Ruich, who was coming to us from Reuters, he actually spent time in the United States over the holidays and then was going to go into China and take over that bureau. And he's still stuck in California. He has not been able to get in. So we only had one reporter in China. That's Emily Fang, our Beijing bureau chief. And so I was in Hong Kong helping her out as much as I could. And I mean, in the early days, January and February, we were just cranking. I mean, it was just constant. You had the Diamond Princess stuck off the coast in Japan, and there was so many stories that were happening around this. And at the same time, we were trying to find out more and more information about what was really going on. in Wuhan, and that was fairly difficult. But it was a good place to be. You actually were getting people. The high-speed trains were still running into Hong Kong from Wuhan. Sort of there when they announced that they were shutting them down, and the last trains that were coming into Hong Kong were with people who were just desperate to get out of there. That some of them were foreigners who wanted to make sure that they were able to get back to wherever they were going. Others were residents who were just terrified of what was going on. And eventually NPR did pull me back because it became clear to them that global air travel was starting to shut down, and they didn't want me sort of stuck somewhere. And so it was right at the end of February I came back to the newsroom in DC. Right at the end of February, beginning of March, I came back into the office, and it was really interesting because I told people look, we're screwed. If China is doing what China's doing to try to contain this, and they're not completely containing it, we are going to have a terrible pandemic here. And it was really interesting. NPR's newsroom is full of a lot of smart people who are very engaged. I got cast as the Cassandra of the newsroom, and it was really interesting because having been in Hong Kong and seen both the terror that was, people were very worried. They'd also dealt with SARS, very concerned about it. It was clear to me that this was going to be bad. And when you looked at what the U.S. was doing at that point in time to try to prepare for this, it was nothing compared to what was happening, in other parts of the world, particularly in that part of the world. And people came around fairly quickly, to how significant. It wasn't that NPR didn't view this as a significant story, but I think just a lot of people thought we were going to dodge a bullet somehow, miraculously. I also, in my beat, cover infectious disease, and just knew that, this virus is going to behave the way this virus is going to behave. We're seeing the way it's behaving in China at the moment, and it's going to spread. It's going to spread like wildfire. But after that, then I went into that same lockdown that everybody else did. I got sent home. I've been in this room, this spare bedroom of our place, for more than a year now, working from here. And it's just been a completely different form of reporting for me. Some of the stories that I'm most sort of proud of that I did are sort of data stories. We figured out early on that it looked like COVID was going to be the leading killer in much of Latin America, and did some stories on that. But it was completely different from what I usually do, which is to go into some place, get stories of the people on the ground who are being affected. And I was also continuing to be in this sort of NPR divide of I was covering stuff outside the United States while other people were covering what was happening inside the United States. And it was just really difficult at times to even figure out, where should we be reporting on? Is it more important to do a story about the fact that things are really low in Vietnam, or is it more important that we look at some surge that's happening in Eastern Europe? It was almost like the entire world had just gotten dumped on our plate, and it just deciding what story we were going to do each day was difficult. And it was, I don't feel like I did the stories that really sort of sing from prior to this. Of the stories in the past that I like to do, I like to, people hear the sound of the place and get the voices of the people and the personal stories. And it's been really hard to get that over WhatsApp or Zoom. The pandemic changed my life, changed my professional life. We persevere, and it's different. And I look forward to getting back to being on the road again. But we'll see. NPR is talking more and more about that now, but it's been really limited in terms of how much our reporters have been able to travel.
Thanks, Jason. Well, that you brought up a very interesting point about the early days of the pandemic, before it was even declared a pandemic. That I was hearing from experts that seemed extremely credible that we needed to do a lot more to to prepare, that it seemed almost inevitable that it was going to come here. And yet there were also experts saying it would not to panic, it wasn't going to be a big deal, we shouldn't worry about it. And I wondered, how did people know which experts to listen to? As an opinion column, I listened to the ones that I thought were making sense. But there were experts saying, that it wasn't likely, that, the risk was very low, trying to reassure people.
The dogs in the street knew.
What was that again?
The dogs in the street knew.
The dogs in the street.
I quoted Jeremy Farrar, the head of the Wellcome Trust, on January 14th, saying this is likely to be a pandemic. Everyone knew, and China was celebrating its New Year's, and they knew that was going to spread it in China and that people were going to leave China. People were coming into the United States from all over, coming into Europe from all over. We had a Trump administration that was actively working against data and facts, that was gaslighting us and telling us things that were completely wrong to anyone who paid any attention to the data and facts. It wasn't hard to see what was happening in China. And the report that came out from the WHO mission that went to China in late February spelled out in tremendous detail how this virus works, who it selected, what it hit, what it did, how it moved in households. We knew all of that. And on February 25th, Donald Trump held a press conference and said, we have 15 cases and they're soon going to be near zero. We were lied to. And
to be fair, though, John, I think there are people who didn't think that it would be a pandemic right away. I spoke to Malik Paris, who I'm sure you know. He's a researcher who's worked on bird flu and SARS and MERS and every virus. And I spoke to him, I think, in mid-February, and he said he didn't think that it would be a pandemic and he really hoped it wouldn't. And I think part of the reason a lot of people thought that is because we had already been through so many of these false alarms, if you will, that were big problems elsewhere, but didn't really come to our shores and didn't cause huge problems. And that WHO report that you mentioned left out some very important details. They left out, for example, that there is asymptomatic transmission, even though that was actually pretty much clear by then and should have been in there. And it left out, for example, that China was classifying anybody who had even pretty moderate symptoms as being very mild. They had a very high bar for what they considered symptoms so that their numbers could be very low. There were a lot of things like that misled us into not thinking this would be a very big deal.
Yeah, I take your point. And the WHO report has other deep flaws, including the fact that it was not allowed to look at origin at all. But as a real-time document, it was tremendously valuable to understand what was happening in China. And the notion, I know Malik Paris, and I have a lot of respect for him. And I also interviewed people who were skeptical about how fast and furiously it would move around. But by the end of February, it was perfectly clear. And WHO was dragging its heels on declaring it a pandemic and on calling it a public health emergency of international concern. And most everyone I interviewed about that thought it was ridiculous, that it was obvious. And so it didn't look like SARS and it didn't look like MERS by the end of February, surely, when the US government was doubling down on telling the population that there was nothing to worry about. And in fact, muzzled Nancy Messonnier from the CDC when she suggested that it might be severe. And they took one of our leading experts and told her she couldn't speak any longer. It was absurd.
But to me, that was actually probably the most challenging aspect of reporting on this, is that we couldn't really trust our usual sources of information. You couldn't just take for granted that what's coming out of the CDC is, more or less believable. Even if you don't fully think it makes great scientific sense, you could at least believe that it was well-intentioned. And we couldn't believe that anymore. We couldn't believe that, actually, I will say that, even of the WHO. I think they were under so much pressure from both the US and from China that they really did not tell us things that they should have told us a lot sooner. So, it's hard enough to be dealing with a brand new virus. It's hard enough to be dealing with a virus that even the biggest experts know very little about. And then on top of that, to have these public health agencies confusing us, misguiding us, and leaving out valuable information, that was just incredibly difficult.
Yeah.
I think the problem with the WHO is more about just their lack of power. I mean, I feel like they are so worried about offending one state or another that they wouldn't be, they just weren't as forceful as they needed to be. And I think part of the issue is often a misunderstanding amongst our readers and listeners about what the WHO does and is capable of. And I think that the WHO, they just don't have much power, and they are terrified of upsetting one of their member states. And
and funding.
And funding, yeah, and that was, but it's also just interesting to think about the fact that there isn't some organization that is powerful, that is able to just come out and say, this is the way it is. We don't actually have that in the world. And this pandemic showed that, unfortunately. And I've got a lot of respect.
The CDC used to be that before this pandemic. The CDC was the go-to place for a lot of this public health information, and it was the go-to place for people all over the world. I mean, I spoke to somebody at the South Korean CDC, I think it was in early March, and this woman was stunned. I mean, I could just tell in the way that she was talking about it. She kept saying things like, our CDC is named after your CDC. Everything we know, we learned from you guys. We don't understand what's happening.
One of the real challenges for me, and I suppose it's true for the two of you as well, is that we're not like Faye. We're not opinion reporters. And I couldn't criticize my government explicitly, and I still don't have that freedom. I can speak about facts that were twisted, and I can speak about bad actions that occurred to prevent the free flow of information. But I was biting my tongue and it was squirting blood when I listened to things coming from the White House that were scientifically wrong and misleading with a purpose. I also think, as Jason said, the WHO has a really limited ability to challenge member states, and it couldn't challenge China and continue to be the WHO. I think their press conferences were exemplary in terms of putting forward experts who spoke plainly and bluntly and scientifically and passionately, and were really helpful at a time when the press conferences from the United States were just time sinks. They were just wasting our time. And they were these White House carnivals with what ridiculous thing is going to happen today. And we watched them like a soap opera because who knew what Donald Trump would do next? Oh, we're going to inject bleach now? And this just went on and on. And I'm so glad to be done with all of that.
This is where it pays to be part of an ocean liner, because we actually, at the Times, have a desk that is dedicated to countering misinformation and disinformation. So their job is to look at what is trending on social media that is a lie or is false information, and then to counter that very directly. So that freed up some of the science journalists from having to do that actively.
Great. Well, I have some great questions that have come in from viewers, so that's exciting. And I did want to just back up and say, one of the things that happened early in the pandemic was that even in January, people were calling for preparation, which is when we really needed to start doing something. When you think about the lives that could have been saved if we had started getting ready for this thing to come here in January. And there, I think that there was a little bit of a mixed bag from experts all over, and that's sort of a challenge.
I want to point out something in January that's important. There was a test developed by German researchers for the virus that was widely used around the world, and the United States refused to use it. So we didn't have a diagnostic here because we had to go it our own and make our own. And that test that we made, that the CDC made, was a disaster. And we also limited who could make tests at academic and hospital labs all over the country for a prolonged period that was similarly disastrous because they all could have been doing testing. So we played ostrich.
Yeah, I think that is a very important point, that we have these very misleading numbers about how many cases were here. We had no idea how many cases were here. It was probably a huge number. So we're going to go to a question. This is a more provocative question. This is from Barbara Betts. How many stories with headlines like how India conquered COVID-19 have been justified given the uncertainties of the science? That's an extreme example, but from very early on, stories have been published with a, quote, end of story headline. So I guess, has anyone written a story that said how India conquered COVID-19? And if so, what's your view? Or if you haven't, are there stories like that where something changed, where it looked like a country was doing pretty well and then it turned around and wasn't doing very well?
Sure. Okay. I'll confess. I had one of those on Singapore early on. You know, it looked like Singapore was doing really well. And yeah, but at the time, I think it was a very reasonable story to do. It looked at how Singapore was containing things. I can't remember when exactly this was. March, April, might have been, I think it was around April that I wrote that story. And then it started spreading in these migrant dormitories where they've got workers sort of packed together in crowded environments, and Singapore was all of a sudden doing terribly. But we followed up on that, you know, and we did stories about that as well. And I mean, I think this has been a learning experience for all of us, as well as everyone else, right? For journalists as well as everybody else. And this virus has surprised journalists the same way it's surprised other people. And you know, I think it's valid to do those stories while India looked like it was conquering things. And yeah, certainly we're now doing the stories about how terrible things are in India.
I have a particularly painful example along those lines. Early on, I would say until the summer, I was writing stories about kids and schools, and the fact that we didn't know a lot about whether kids can get infected at the same rates and whether kids can transmit at the same rates. And there were a lot of people who were saying that there was plenty of evidence from Europe, but I don't really think that was the case, because there was a lot of mixed data there, and there were a lot of confounding factors. And I think over time it became more clear that for some reason, kids don't seem to be as infectious as adults. But like Jason said, I think that's at the time, it was a very reasonable thing to assume and to try to be, cautious about, because there's not a lot of precedent for a virus that's suddenly just going to be not very contagious from kids, but is from adults. TB is like that, but among viruses, there really aren't any examples. So there was no reason for us to think that kids would be magically spared. And that's why I wrote that. But that has come to haunt me ever since. And people to this day on Twitter are very free with their abusive language and calling me all kinds of names and saying that I am single-handedly responsible for the kids of this entire country not having gone to school for the year.
Well, I've been accused of, I've been attacked on Twitter for the opposite when I interviewed some experts about how important it was for kids to be in school, and then I got attacked for basically killing children. So I don't know, I think my attackers have a stronger case against me. So you can't win in certain, and that's one of the things about covering this pandemic. There are certain hot button issues. School might actually be the hottest. You almost can't say anything about that without a flame war erupting on Twitter. You're sort of damned if you do, damned if you don't. And you can interview the most thoughtful experts, but people respond to the headline. Yeah, and I wanted to get back to Barbara Bett's question. I wrote something fairly early about Singapore as well, because they had such an interesting system of contact tracing, where they actually had a website. You could see like that there was an outbreak at this church, and and so you could see so much that would have been considered kind of a privacy violation here, and yet it helped people to see how the disease was spreading fairly early. That people could see fairly early on, you can get it in church, you can get it. So whether Singapore, ended up having a lot of cases later, it still was, I think, an interesting thing to write about. I think one of the things that we're learning is be very careful that your headlines are provisional, that you say, how India seems to be doing well in the pandemic now, because it can turn around. And I think in general, people have often overestimated the role of human control and underestimating those chaotic, random factors that seem to cause the disease to die down unexpectedly in one place and flare up in another. So
Singapore
yes,
I want to jump in on Singapore. Singapore was fascinating, though. I mean, they were using their police to do contact tracing, which isn't, it's not a crazy idea, right? Police know how to find people. They know how to track people down. And they were throwing everything at contact tracing. In every case, they would trace aggressively, which was so different from, remember when contact tracing started in the United States? It was just a disaster, right? It was just like everybody was trying their own system. And there were, yes, Singapore was a little bit overly open about the information, but especially from a journalist perspective, it was fascinating. They would tell you who had lunch with who and where, and you could see these patterns of transmission. And if more people had understood those patterns of transmission, you could have slowed transmission in other parts of the world. But that just wasn't happening. Singapore was a fascinating example early on of a place that really jumped in and with great vigor.
During the SARS epidemic, Singapore actually made people who were infected show up in front of a video camera at certain times of day, just to make sure that they were actually quarantining. So Singapore has some unusual approaches.
Yeah,
I was fascinated too. I was kind of hooked on their website because you'd see this and think, wow, what if they did that here? Every outbreak and case and who and what the ages of the people and where they got it. And it was, it was you could end up looking at that every day.
A lot of this, though, speaks to the word provisional that you mentioned, because so much of what's happening during a new outbreak and a new disease is we're learning on the fly. And people are, as they like to say, building airplanes as they're flying. And so information changes. And I agree that we have a responsibility not to overstate and feed that hunger for certainty that audiences have, which is the trap. That's the real problem. People want certainty. They want to know that it's over in India or it's over in Singapore. Audiences want that kind of information. And we can't give that. And, that's the tension I see again and again. And the provisional aspect has been one of the biggest disconnects between the public and the media and science this pandemic, because science comes up with new information and then people say, but you said, well, yeah, but that's before we knew. And it looked a certain way and it doesn't look that way now. And it's that ability to shift gears with new information that is what makes science, to me, such a valuable way of thinking, because you're allowed to change your mind. You're not a politician who says, I'm not going to raise taxes. You see that, hey, remdesivir looks like a miracle drug. And then you think, as more data comes out, wait a second, who does it really help? What's it really doing? And those kind of adjustments are important to be honest. And I don't think the public in general, if I can speak in giant terms, has much appetite for that way that knowledge moves forward.
Thank you. I think that is absolutely true. And John and I both covered scientists in different fields for a long time and are used to this idea that it is all provisional. Some ideas are, are pretty solid, others are not, but that you're always warning people that ideas can change. And then it is responsible to go back when something big changes, like, the place you said had conquered the pandemic suddenly breaks out in the worst outbreak ever. So here's another very provocative question. This is from Uriel Abulov, who is a professor, and he writes that tobacco kills annually over 7 million people directly, another 1.2 million indirectly worldwide, and about 500,000 in the US alone. And we can do much to stop it. Should we give it the same media coverage as COVID? I have an answer I can think of, but I'm going to throw this out to the panel first. Anybody want to grab that one? Maybe Apoorva?
It's just not, these comparisons always, they kind of raise my hackles because it's not either or.
And it's also not a very, I don't think it's a fair comparison, because tobacco, that's something people choose for the most part. And we're not, it's not the same as being subject to a virus that you don't even see or know how to protect yourself from at the beginning. So I don't know that's a good comparison.
Yeah, I think my answer would also be that I don't think that our coverage is supposed to be directly proportional to how many people die of something. It's how much people need information about it. That it wouldn't matter, even when a few people had died early on, it was new. People wanted information. It was important to tell people what the experts knew. And so I would say that no, tobacco doesn't deserve as much coverage. And that our coverage is not, we're not obligated to cover things in proportional to the number of people who die annually.
What's news? News is telling people things they don't know, that's new to them, that they either want to know or need to know. And if you came up with a cigarette that made people live longer lives, I'd be all over that story. Be a fabulous story. Yes. So if there's news there, we go there.
Yes, that's true. I mean, we covered opioids when that was an epidemic. It was, it had started to explode after cigarettes had been killing people for a long time. And then that had been pretty thoroughly covered. People are still covering it, but there was absolutely no information at the outset about COVID. So we were, people absolutely, I think that the need for information was greater than it's been for just about any health crisis that we've seen. So let's try, let's see, we've got some more questions from, let's see. This one is a little more general question, but I think this one it's a good provocative one. This is from Joanne Hirschfield. As journalists, how has politics in the election affected honest and objective information gathering from science experts on COVID-19? You want to start with that, maybe Jason?
Well, I mean, I ended up covering international stuff, so I was not the one having to deal with what Trump was saying or what was coming out of or not coming out of the CDC in the early days, and I was very grateful that I didn't have to deal with those issues. But this was a huge part of this story. But it is also interesting when you look at this from an international perspective. Elsewhere in the world, the places with sort of particular populist regimes, you look at Bolsonaro in Brazil, you look at AMLO down in Mexico, these leaders did not handle the pandemic well. They were basically deniers, fell in line with a lot of what Trump was saying. And in places around the world where that has happened, things have not gone well. So there even has been sort of a story that I think can come out of it, and that certain political systems function better at containing a viral pathogen than others. I think, benevolent dictator could do a really good job in containing it. If you're going to give them the right information, I think it would actually be a really fascinating example. But as journalists, it's difficult to cover, and it's difficult to cover oftentimes when it's inside your own country. I had the luxury of being able to, be critical of Bolsonaro and other leaders. I think it's harder for oftentimes for the local journalists to do that. And I think it was very hard in the United States to have to deal with a lot of the way that this, what should just have been a science story, became so political.
Yeah, that is one of the things that has really made covering this different from covering other science stories, that I don't think I've ever covered anything that got as politically polarized as this. And, I think that the experts I talked to outside of government were completely free. Inside government, it was a different story. And so I don't know, let's maybe, Apoorva, do you want to talk about how the election changed things for you?
Yeah, I mean, the election has actually completely transformed the way I report, because before the election, when the Trump administration still was in power, almost all of the scientists that I spoke to were against the Trump administration. And I mean, they're obviously on the side of facts, but they also felt very passionately about it. And so, the Times has very strict rules about, we try to be very careful and fair. And so there was a lot of times I had to sort of guide scientists back to just talking about the science. But it also made it very difficult to get information in the sense that almost all the reporting I did was anonymous sources. And I actually remember when they announced the winner, they announced Joe Biden as the winner of the election, I was on the phone with one of my sources from the CDC, and I could hear cheering in the background because almost everybody who works at the CDC in that whole neighborhood were all Democrats. And, so it's just, they were motivated for multiple reasons, and mostly because they wanted to get information out, to leak things to journalists in a way that they aren't even comfortable with. They didn't even want to do it, really, but they felt that this was the only way that they could actually get information out. And I think since the election, that sort of intense need to communicate what the real science has gone away, because now what's coming out of the CDC is actually credible scientific information. So it's been extremely different.
Politics have been, sorry for interrupting you, politics have been intertwined with infectious diseases for as long as I've covered infectious diseases. It's not different this time. And I could name political scandals and outrages that have happened with most every outbreak, epidemic that I've covered and pandemic. It's not unusual that happened. What's unusual is that this pandemic reached so far to every country in the world and was so frightening and shut down economies. And that even tied politics to it more closely than it usually becomes aligned. So you ended up having every country essentially becoming really dependent on their country's response. And that's sometimes not true, because sometimes outside responses can help your country, especially in the developing countries where I work, and Jason works a lot. Sometimes, like PEPFAR came and gave antiretroviral drugs to much of the world, even when governments were failing to supply antiretroviral drugs to people living with HIV in those countries. But in this case, everyone kind of turned into nationalism all over the place. And there's a good and a bad to things. I mean, the Trump administration created a vaccine program with over $11 billion that led to really good vaccines that are helping a lot of people. And so I also want to be objective and point out things that politicians do that are good. And what China did, they showed you don't need a vaccine to stop the epidemic if you're willing to sacrifice the human rights, freedoms, and liberties that most places outside of China aren't willing to sacrifice. And, the politics to me are part and parcel to covering infectious diseases. But since the change of administration in the United States, I share Apoorva's, and I probably it's a lot easier for me to do my job because I don't have to waste so much of my time dealing with politics. That's what it really comes down to.
I mean, I agree with you, John, that politics is always intertwined with infectious diseases, but not to this extent. I don't think it's ever been like that. No.
But we never saw economies shut down like this globally. And politics are so strongly tied to money.
Well, exactly.
And that ramped everything up. And I've just returned from India. I was able to go on a 2-week trip to India. And the politics in India are as thick as the politics in the United States in so many ways. And I didn't really understand that until I was there. And I'm sure that that's one of the real deficits of us being stuck on Zoom, is that you see stuff and learn stuff about politics and its impact when you're on the ground. And it's really hard to suss that stuff out through Zoom. And Jason, you've spent your entire career on the ground, and you know what I'm talking about. It's just, you get to the village and you see it, you get it.
Right. And you hear the same thing over and over enough times, then it really starts to sink in with you. That something that your editor completely didn't agree with, and then all of a sudden you're like, wow, this really is an issue to these people here, and we should be pursuing this. And yeah, this, as I said at the beginning, like, this has just changed the way I've been reporting this year, and I can't wait to get back to getting out into India and other places, and hopefully that'll be fairly soon. I'm hopefully getting my second shot, I don't know, in a couple weeks. So
it's a good feeling.
You're right that there's no substitute for reporting on the ground, but I have found, at least, that there are very good Indian publications, online publications, not so much the print newspapers these days, that actually do a pretty good job of being neutral and actually presenting the situation in India as it is. And that's something I've found to be useful no matter which country I've gone to any African country, or even any country in Southeast Asia, to get a copy of newspapers ahead of time and to read them for a few weeks. You sort of get a flavor for what the issues are, even if you don't, of course, have the same view as you would when you go, when you're on the ground. But it at least prepares you so that it's not a complete surprise when you get there.
Yeah, I wasn't criticizing India media at all. I certainly agree with you. There's a whole lot of great media in India and everywhere I've ever worked. There's good and bad everywhere. But I saw things politically with my eyes. I saw political rallies where no one was wearing masks while cities were shutting down. I saw it. And, it's astonishing to be a witness to things that are so unexpected.
I think we're all dying to get back on the ground. I think that's all.
Yeah, well,
I wanted to ask. I'm sorry. Zoom is tricky with interruptions. I wanted to ask Apoorva, though, before I forgot, about those leaked, people that were leaking information from the CDC, and I wondered if you can talk at all now about the types of information that had to come out of CDC through leaks and anonymous sources, as opposed to the kind of thing CDC should be putting out?
Well, I'll give you one example. When the CDC came out with guidance in August last year saying that people who were asymptomatic were exposed to, infection, didn't have to be tested, didn't have to quarantine. And nobody agreed with that. No scientist in their right mind agreed with that. And everyone was furious. And so were people inside the CDC. So the CDC is so careful. Every single piece of documentation goes through 20 people, and they finesse it endlessly because they want to be so very cautious about everything they say. But this document was written by Brett Giroir and passed around to a couple of other people, but people within the CDC never had a chance to change anything. They saw versions of it. They saw early versions of it and made comments, but at some point they were told, we don't have the capacity to change this document. So you can imagine this is something with enormous public health importance, and the document that was up as supposedly from the CDC was completely wrong, and so they just felt compelled to speak up. And my source shared, for example, the email from the superior saying we don't have the capacity to comment on this or to change this. And, gave me information about how many versions there had been and, who had seen it and things like that. And then I was able to go directly to Brett Giroir and ask. And he said, they signed off on it, but it was obvious from what they were saying that maybe Dr. Redfield signed off on it, but nobody who was normally in charge of that process had any say. So that's the kind of thing that, and the day after that story came out, the CDC changed its guidance and put something that was much more science-based. So it had immediate impact, and it had, immediate public health impact because it changed what the guidance was for how people should behave in these situations.
Yeah, that's a great example, because it was such a sort of shocking development that recommendation came out, and the scientific community at large really reacted almost instantly. Like, what could they possibly be thinking with that we need to find these people before they show symptoms, or the people who don't show symptoms, if we want to contain this. So it was just absolutely counter to what the experts had been saying at the time. So let's go to let's see. We have here's an interesting one about that, sort of related to that. It says, this is from Elizabeth Bass. Many have had COVID but were asymptomatic. Many have had it and were never tested or tested negative. So how reliable are incidence statistics, and what sources do you rely on for that info? I think let's go to Apoorva first on that, because you might maybe have had to deal with that for the Times.
I haven't actually, because we have a whole data team that deals with that. So I trust our team's information. You know, they have all those coronavirus map trackers, and they are very careful about how they collect that information. I think it's absolutely true that we have no real sense of how many people were infected at any given time, but serology tests, antibody surveys after the fact give us at least some, approximate sense that about 10 times as many people may have been infected, or 5 times in certain states, or things like that. So we had some vague idea, but yeah, I mean, we did not have exact numbers anywhere.
John, do you want to elaborate on that at all?
Yeah, there are some websites that are go-to websites. The New York Times is a good resource. The Our World in Data is good. Johns Hopkins has an excellent website, great dashboard. We never know with tuberculosis or malaria or HIV how many people really are infected and what is the rate of new infection. Those are always estimates. And this is trickier because of asymptomatic infection in particular, and because of the dearth of testing. But influenza, we don't know how many people get influenza a year. We know how many people die, because death is a pretty good marker, and that's pretty easy to see, unless, as does happen, and there was a good New York Times story about this last week, people try to cover up death, as has happened in India. But, for the most part, death figures are pretty solid in developed countries. And they do give you an indicator of the relationship of spread. When we have a lot more spread in a country, you see more death. I mean, those two things go hand in hand. So I think, again, don't expect too much certainty, but you can get a pretty good gauge of how the virus is moving around by looking at the official reported case counts from most every country.
I think that's an important point. And one thing I would add is that when I write about COVID statistics, I try to be very careful to be specific about what the numbers really represent. So if cases, often what people are counting are positive tests, it's important to specify these are people who tested positive. Some are sick, some are not. There may be many other people who haven't been tested. It's not the incidence of the disease. It's just the number of people who've tested positive. That can give some information. It's not the whole picture. And early on, I had a statistician tell me, if you're going to compare one region to another, you want to look at hospitalizations, because that's really going to tell you how many people are likely to die. And also it's telling you how strained the healthcare system is. And if one state isn't doing very many tests, it might look good, but actually be pretty bad if a lot of people are in the hospital. So I think some of it is you need to tell people what's known, what isn't known, what can't be known, and then be very specific when you're presenting a number, what that number actually represents, and not be vague about it. So that would be another thing in looking at numbers.
California had 5 deaths yesterday. I mean, that to me says a tremendous amount about something going right. We're an enormous state. You don't have to know any other figures. That simple fact is breathtaking.
I would say that the only thing is that because things sometimes go down and then back up, that watching the cases and the hospitalizations can be an indication. We had, in New England, we had a pretty good summer where almost nobody was dying. And then you could see the cases tick up and the hospitalizations tick up and then the deaths tick up. So
it also doesn't tell you anything about long COVID, which you're not going to see in hospitalizations or in, deaths.
Those are difficult to track. ICU occupancy is a good metric. And I think most every state has that. I think the New York Times tracks that closely. That's a good way to look at how burdened systems are. And likely how the trends are moving. But that's what it's about to me, is trends.
Yeah, I think that it is important to point out that the statistics you're turning to are the same ones that you're going to on a regular basis. Like I turn to the WHO, the Our World in Data has been great. But with this disease, it's been somewhat problematic in that the impacts of this disease aren't always just when people end up in the ICU. So when I'm trying to compare country to country, maybe they don't have very good testing there. Maybe people are much less likely to bring people to the ICU. So when I say that, look, this is what is happening in this country, it can be very hard to compare that to what's happening in another country. And that has been a really difficult one with this disease. It's not like some disease that, it's going to be a fatal case, or, what are the long-term impacts of, say, in places like Africa or Haiti, where we haven't seen huge numbers. Maybe some of those milder infections are going to lead to some wild long-term COVID effects. We just don't know at this point. But if you just think that, the numbers are really low there because there wasn't the testing, it's going to be hard to really predict what's happening in those places. So this has been it's almost like this virus was almost the most difficult to sort of come up with statistics that are clear. Like smallpox, everybody would get the pox, right? So boom, you got a case. It's not like that with this one. And it's just been, it's been this thing we've been trying to grapple with, and particularly comparing country to country has been difficult because of the differences in the ways that the testing happens, the way the ICUs operate in different places. So it's been troublesome for us. It's been something we've been trying to grapple with.
Yeah, the challenge also is it is so widespread. So, what's the real number of infected people in the world? It might be 1 billion, the real number. And so when you get to that high of a number, that much of the world, you can't do valid comparisons because for all the reasons you're saying, but you still can see trends.
Yeah, absolutely. Yeah.
Yeah, and I think it is really important to point out that it's not uniform, that the way things are reported, that who gets admitted to the hospital, all these things vary a lot from country to country. And so people, sometimes it's almost like a horse race when people are looking at the data that's posted, who's doing well, who's doing badly. And I think Jason made an important point that the way deaths are counted, that they do vary from country to country, from a little bit from state to state as well. And so I think those are important things for us to keep informing people about. Also, it's very interesting.
In the States, though,
yeah.
Sorry, I was just going to say that in the States, this is only going to get harder because we're not going to be able to look at hospitalizations as much anymore. As high-risk people get vaccinated, the virus could be circulating in younger people with very mild symptoms or no symptoms, so they don't get tested, and we don't know.
But I do think there's an astonishing amount of data now about the impact of vaccination on communities. And those data are believable, they're solid, and they're really filled with hope.
I'm not saying that the virus is going despite vaccination.
No, you're pointing to the other side of things. But I'm looking at how do you understand what's happening. And one of the things I clearly understand is vaccines work. And when they're used widely in communities, you see death rates and hospitalizations and ICU plummeting. And we're going to see that over and over again in places that can access vaccines and people who choose to use them. We're seeing it right now in the elderly in the United States. There was a CDC report yesterday, and it's incredibly heartening. And those are data, and they're solid.
So let's go to a question here. A couple of people have asked about the origins of the pandemic, and I do think that's a really interesting question. And I think, John, you touched on that a little bit with your contact with people in China. They can be hard to reach, and I think it has been kind of disappointing that we still don't have a lot of clear answers about where this came from. I remember with the SARS epidemic, there was an investigation. They actually figured out that the civets were the intermediate animal. They figured out which kind of bat gave it to the civics. So what do you, well, I'm really curious about your take on the origin what we've learned from WHO so far.
I think the what history tells us, and I did a story about this, is it usually takes quite a long time to figure out the real origin of any outbreak of an emerging pathogen. HIV surfaced in Los Angeles in 1981. The virus is not from Los Angeles. That's not where the zoonotic event occurred, where it jumped from an animal into a human. That happened most likely in Cameroon, probably almost 100 years or 80 years earlier than when it surfaced. So I'm not so dismayed that it's taking time to figure this out. The SARS, it took quite a while for SARS to link the civet virus to the bat virus. That took time. And I do think that China has behaved badly here. And I think the U.S. government, the Trump administration, fueled the bad behavior by asserting that they knew that the origin was from a lab leak. It's plausible that there was a lab accident. I don't think it's plausible that it was genetically engineered for a long list of reasons. I think it's most likely that history is repeating itself and it jumped from some animal into us. And with more rigorous, open and scientific investigations, we may find that. But what's happened is story after story has jumped on this lead or that. Oh, pangolins, the pangolin story got tremendous attention. Pangolins are not the origin. They may be somewhere linked in the chain, but they're not the origin. So I think
the visuals are good with the pangolin.
The visuals are good, and it also meshed with an animal conservation movement that pre-existed to protect that animal. So people wanted to say, protect the animal. And so we get sucked into hypotheses, and theories thrive in the absence of data. And there's a tremendous absence of data, which allows for a great deal of speculation and a great deal of emotion from people who want to blame something or someone because that's human nature, to want to find an explanation, to say, hey, if it had been different, this need not have happened. And in reality, for most emerging infectious diseases, there's not a whole lot anyone could have done ahead of time based on the way we approach our civilization right now.
But just from a reporter's perspective, this has also been another difficult one. Unfortunately, it was in China, and China has China's system, right? They've got the way they operate. They are, they crack down on scientists who speak out. They are much more closed than other places. And it's been very hard as journalists to be trying to deal with both that, the WHO, which doesn't want to push them. And so, we want answers. We want to be able to talk to people who are studying it. And it's just been really hard to get that as journalists and get something that really, our editors want answers, our readers, our listeners want answers. And it's been almost like the worst case scenario as journalists to try to be pursuing that story and that storyline.
We were also misled from the get-go. When this surfaced in the end of December, it was linked to a seafood market. And when the first scientific papers came out and I read them, I noticed that a number of the earliest cases had no link to the seafood market. And I did that story questioning the seafood market. I don't know whether it was maybe January or early February. I don't remember the date. But it was clear to me from the literature, from the scientific literature, that the seafood market hypothesis was a bag of goods. And it amplified things, surely, but that misled everyone from the get-go, and there were politics surrounding that because Wuhan was the Wuhan city officials were trying to keep this tamped down, and hey, we closed the seafood market, everything's fine, there are no more cases. So that started the ball rolling in creating great confusion. And it amplified from there. There was a report of snakes. There was, everybody just started throwing out all these speculative ideas. And the proximity of the Wuhan Institute of Virology to the outbreak is, to this day, perplexing. Why, of all places, did it surface in Wuhan? But I could recount for you a lot of things like HIV in Los Angeles. The pandemic influenza H1N1 in 2009 was first sequenced at a Navy lab here in San Diego that had a long history of doing influenza virus research. Ooh, spooky! You know, you can go there. You can go there in a heartbeat. So I would say be patient. We're getting the ball rolling now. We may well get an answer over time, and it may come from a very surprising place. This may be far more mundane than exotic. And, you know, I have had my own speculations about some mundane sources that would be overlooked because they're so mundane.
But it's such a crucial question. I mean, it's, you know, like if it happened, I mean, obviously we're all just wanting to know, like, are we at great threat of this happening again? And I think we are.
Yes.
But the question is, yeah, if we don't understand, obviously, where it came from, it's going to be very hard to protect ourselves. And yeah.
Good. Yeah. There's a really interesting book that I have on my shelf that I've referred to a few times. It's called Spillover by David Clauman, another great journalist, someone I had on my podcast. And when you read that, you see the history of many other infectious viruses and how they jumped to people, some, you know, in exotic and mundane ways. And I think, you know, the bottom line is, as you said, Jason, it's important to get to the bottom of it, because it could happen again, and we do need to understand this so that we can better control whatever kinds of activities are likely to lead to another spillover event. So here's a question on a somewhat different topic, but I'm curious how people might have handled this, because it's a pervasive thing. We've all heard it from friends, from, you know, it's out there. This is from Deborah Glazier. She says, I've heard this one consistently around here. Weren't hospitals incentivized to report deaths as COVID related, so that it's difficult to trust the death data? Does anyone want to handle that one?
This is one of those pernicious myths that got started. Yeah, and I've heard it a lot too, and it's not true. They were not incentivized to report deaths as COVID deaths, and if anything, COVID deaths were probably underaccounted. I don't know. Do we need to go into more detail than that?
I agree wholeheartedly. It's one of these myths that got traction. There was a documentary called Plandemic that was filled with mistakes, and Martin Ensrink and I did an article fact-checking it, and it fed an appetite of conspiracy theorists in particular. So I agree with Apoorva wholeheartedly. It's not. There's no evidence of it, and it's just not worth pursuing.
I think it also made people feel better if they didn't want to believe what a pickle we were in.
Yes.
You know, it just made it seem like, oh, the numbers can't be that bad. I mean, I have friends who said that to me. That
Yes.
say, the pandemic can't be that bad. I heard that the doctors are just making the numbers bigger than they actually are, and I think that was reassuring.
The pandemic brought up the Kubler-Ross stages of death, and people had to go through denial. And denial's just been a huge part of the political problem for so many countries, and that was the Trump administration's problem.
Some people are still in it, John.
Some people
a lot of people are still in it.
Lots of people are still in it. And, a lot of people haven't seen the disease firsthand, and they haven't seen people really suffer, and they don't feel connected to it, because so much of this disease is readily handled by our immune systems. Most people can handle this virus. That's why all these vaccines are working, because it's a relatively easy virus for our immune systems to handle, unless you have for the most part, this isn't 100% true. There are a percentage of people who have no obvious comorbidities and don't have senesced immune systems because they're old, who suffer. That happens. But for the most part, people can handle this. So the denial is fueled by people not seeing the disease, I think. What they see are the lockdowns.
Yes. Yeah. No, I think that's true. That is absolutely true. People see this. In fact, that was a question I wanted to throw out to the panel, which is, how has your own how have your own feelings about the pandemic, your fears, your concerns, your experiences affected your reporting, if at all?
I can take that one.
Okay.
I have two children. I have one in elementary school and one in middle school. And my husband is a squash pro. And very soon after the pandemic started, the club shut down. So his colleagues were asking me, when is it safe to go back in? When can we teach indoors? So, everything I was writing about, aerosols, indoor transmission, was directly relevant to that. And everything I was writing about kids in schools was directly relevant to that. And now my parents live in India. I have dozens and dozens of uncles and aunts and cousins who live in India, and it's terrifying for us, anybody from India to get up and in the morning and know that there will probably be bad news waiting for us. And I guess the way that I've dealt with it a lot, actually, is to just work, to try to have as professional a relationship with this virus as possible so that the personal can be a bit more muted. I think when it's all over and things are really, really back to normal, I'm sure I will then, have some form of PTSD and have to cope with it. But for the moment, I just really try to focus on work. And, for example, even what's happening in India, I felt so helpless that I couldn't do anything. Here I am, I've reported from India dozens of times, and yet this time I'm not fully vaccinated and I can't go. So I collaborated with the Delhi Bureau on a story about the so-called double mutant variant and what that means. They did all the on-the-ground reporting and I did all the science, and that at least scratched a little bit of the itch, but it's hard. It's hard to be living the pandemic while you're reporting it.
Interesting. Yeah. Well, having family in India must be really extremely difficult and trying. I can imagine. It seems like the situation there is beyond just about anything that we've seen anywhere at this point.
Yeah, and obviously, my parents are elderly and they couldn't get a vaccine at all for a really long time, and then they finally did, and then they were told week after week that they couldn't get the second dose because the supply was down, and eventually they finally got it last week. But it's been a very tough situation for them and for everybody in India, and for those of us who have loved ones there.
Yes, and it is also, how do you feel now that they have the vaccine? It must be quite a relief that they've had
it is, but again, here's another situation where I'm living the stories that I'm writing. My mother is immunocompromised, and I recently wrote a story about how people who are immunocompromised may not produce antibodies in response to the vaccine. So I was terrified that she wouldn't actually respond and that she would be just as vulnerable as before. And mothers, I'm sure I'll be like that one day, but she wouldn't really listen to me. She kept saying, I'll be fine. I don't really need a mask. And so it was really quite scary. But my dad told me that she did actually have a fever for a day and a half after she got the second dose. So that made me very happy.
Yes, that's a good sign. So I guess we're getting close to the end, but we have a couple more good questions here. One is from a student, Priya Pradhan, who says, how have your reporting methods of finding leads, interviewing relevant people, organizations, and storytelling as a whole changed with COVID? That's a good question, and I think all of us have made some changes in who we report on and how we do our reporting. So anyone want to take that one on?
I'll jump in on that. It's been tough just in part because this is such a global pandemic and that there's stories all around the world. And so, but the basics though for reporting are the same. You dive in, you start by reading the local newspapers, you check social media, you see who's talking about this stuff, and pursue it from there and try to find people who are tapped in, who can basically get you to where you need to go. So the basics of journalism are still the same. Get in, get as much information as you can, try to find the people who know the answers or know the people who know the answers, and just try to work your way in. So it's not completely different. It's, as I said, I'm not traveling the way I used to, and I'm not doing some of that other stuff that gives a lot of the color and whatnot. But the basic reporting, it's still the same.
The Zoom restriction made me far more productive than I've ever been because I couldn't go out in the field, which takes a lot of time. And, travel sucks up a tremendous amount of time when you're not actually reporting and writing, just moving from place to place. And I travel about 25% of the year. So for me, it's been the most productive year of my life. I've never worked this much. And I'm really glad that ended come like the end of December or so. My life started to return to its normal pace of just working a tremendous amount, not an insane amount. And the Twitter flood of information, because Twitter is a phenomenal resource that all of us use, combined with all of this reporting coming out of everywhere, every country, that I struggle to keep up with. I use Google Translate every day to translate languages I didn't even know existed. And it's, I've translated entire press conferences with Google Translate in real time, trying to make sense of stuff that I'm typing and reporting in real time. And I've never had to rely with so much pressure on all these tools to figure out what's happening. So that it's the compression of everything, and Zoom unfortunately makes us more productive and creates a vicious cycle where it's like, okay, what are you doing next? What are you doing next? What are you doing next? And if you're working with a team of journalists, everybody sort of feeds off of each other, and it turns into a frenzy. And I think all of us went a little crazy at science, and had to kind of back off at some point and say, okay, breathe, breathe.
For me, I started out as a reporter many, many years ago, and I spent a little bit of time as a daily news reporter, but for most of my career, I've been an editor. And for the last 13, I was an editor-in-chief, so I rarely did any news writing. And I was still writing, but they were, long form pieces that I could develop over months and spend a lot of time with the people in my stories and really take my time. And this return to being a news reporter and at this insane pace was really something. But I wouldn't have it any other way, because I think one thing being an editor has taught me is to spot stories. And at any given time, at any point in the pandemic, I had a Google Doc list that I shared with my editor of 14 stories or 15 stories that I wanted to get to. So I was happy to be writing fast because there was so much I wanted to get out, so much information I wanted to cover, so many stories I wanted to write. And there were weeks I had 7, 8, 9 bylines, and it still didn't feel like enough. So I'm like John, I'm glad that slowed down, and I've actually been working on stories. I've gone the last couple of weeks only having 1 or 2 stories a week. It's been amazing. So, and very, more thoughtful, sort of longer pieces that take more time to report. And it's been wonderful.
I never wanted to be a wire service reporter, and I've done wire service reporting for UPI in the past, and I didn't like it. And this turned all of us into wire service reporters. It's like I couldn't, and there were many nights I got up at 3:00 and just went to work. I just, I was just overwhelmed with how much I had to get to do. And I had days on end where I slept, 4 or 5 hours, that went on and on and on. And it wears at people, and it wears at the group you work with. We didn't have any meltdowns, but all of us got fried doing it. And I look back at it and I'm really proud of our product. Yes, we did it, but it's like running a marathon, it's nice to get to the end and we're still covering it. I'm still running, but I don't have that fever.
So let's wrap up with a question. We have a question that is kind of forward-looking and also gets it sort of, I think, the story that a lot of us are looking at now, which is the vaccine rollout and the sort of slowdown of the vaccine rollout as people are less enthusiastic about getting the vaccines. So this is from Jean Earl. While as journalists you speak of sources for statistics, for deaths, hospitalizations, et cetera, do you have any sources you rely on for vaccine hesitancy and what the major drivers are? Any expectations for the future in regard to this information? So I think this can be a question about vaccine hesitancy or about where you see this going in terms of journalism and in terms of what you see as the next stories we're going to be covering.
I'm happy to start and take it a little bit from the international perspective, and particularly in low and middle income countries, we're not seeing vaccine hesitancy. We're seeing just simply not access to vaccines. We're seeing people who cannot get vaccines, who want vaccines, and we're just not at that phase yet where you've got enough people vaccinated that you've gotten through to that pool is left of people who are hesitant. And I actually think a lot of the hesitancy that you're seeing abroad in low and middle income countries, you get some expressions of it. I think it'll probably go away when people actually have a vaccine that's being offered to them. I think that you're not going to see that. But a big story for us is going to be the continued inequity in terms of access to vaccine in the coming months. There's a lot of stuff that's in the pipeline, but between now and the end of summer, there's a lot of places in the world that are going to be just operating on fumes in terms of the amount of vaccines that they have access to.
That's really important. Yeah, I think that's something we'll be looking to you to keep covering. It's sometimes it's nice to see the vaccines, the supply grow in the U.S., but also just sort of a sobering reminder that that's not the case in a lot of places. Anyone else want to talk about either vaccine hesitancy or the future of the pandemic and future of your coverage of the pandemic?
Well, I think within the United States, the vaccine hesitancy, it comes in many, many flavors. So it's sort of hard to put it all into one big pile, which we tend to do. But, people are hesitant because they need more information, or they're not, early adopters, and they want to sort of wait to see what happens to everybody else, or they heard something that is misinformation and they need that corrected, or, they're afraid of side effects, or, and then the big one that everybody has been talking about is the political one, where a lot of Republican men especially don't want to be vaccinated. But I don't know, maybe I'm an optimist, but I think most of those people will come around over time. And I don't think we'll ever get to 100% or even 90% of people vaccinated, but I think it won't be where it is now, which is, just about 50. I think it will get better than that. And that will mainly happen because there are very thoughtful people thinking about how to approach each of those groups. And to address each kind of hesitancy with a different approach. I think that's very important. And globally, Jason was talking about the lack of vaccines. I think that is going to be the big story, and I think it's going to be the big story for the next couple of years, actually, because there are countries that aren't going to see a single dose until 2022, and then they won't be fully vaccinated until God knows when. So I think that will keep playing out, and I read a lot about variants, so that's sort of where I will also be looking to see how the virus is evolving, how the virus is changing, and what we can learn from the virus based on the way it's changing. I think it'll all play out over the next year or two.
Vaccine hesitancy reaches back to the first vaccine with Edward Jenner, the smallpox vaccine, and the anti-vaccine movement has to be separated from hesitancy. They're two different things. People who are anti-vaccine don't want any vaccines for any reason. And most people aren't anti-vaccine who are hesitant. They have concerns, and Apoorva spelled out several of them. And some of the concerns it's very understandable. You're healthy. Why do you want to inject something? So the way I address vaccine hesitancy is always through the lens of it's a moving target. It's shifting all the time. It has shifted a great deal in the United States in opinion polls over the past 6 months, and it will continue to move all over the place in different communities in different ways. The bottom line with other vaccines and what we've learned over time is that, number one, when people see vaccines working with their own eyes, hesitant people run to go get vaccines. And that often happens because there'll be a family where everyone but one person is vaccinated, and that one person gets ventilated and comes near death. And everyone who knows the family sees it, and the hesitant people connected to that run to get vaccinated. That will happen because the vaccines work and are largely safe. But hesitancy is also linked to risk. And as we see again and again with these vaccines, there are risks. They're real. They're not common. They're rare so far, but they're real. And so it's about also educating people about understanding risk and benefit, which the public isn't good at understanding. We have a law that forces people to wear seatbelts. Why? Come on, seatbelts work. And you also know that if you get into a car crash and you're wearing a seatbelt, you might die. But you know that it does something to protect you. And we have another problem that is pervasive here, and that's the herd immunity goal. I don't anticipate the United States reaching herd immunity through the vaccine program anytime soon. I do think what's going to happen relatively quickly is we're going to see death and ICU admissions dropping precipitously. And we went into lockdowns because of hospitals collapsing. That's why we went into lockdowns. And so I think we're going to see really positive things happening in places that can access the vaccine. And as both Jason and Apoorva said, the story is going to become access and equity. And it mirrors what happened with HIV, where antiretrovirals that worked against the disease were first shown to work in 1996. And it took until really 2003 and the advent of the Global Fund and PEPFAR before most infected people in the world even began to get access, which was a 7-year gap. And it took until 2000, until the Durban International AIDS Conference, where it became an international issue. So this time we're starting off where it's an international issue. We know right now, a few months after we first found vaccines that work, that there's a gross inequity underway right now. We know that. And it's being talked about, and I'm heartened by all the discussions, and I'm seeing actions every day that are adding to my confidence that it isn't going to be as dire as it would have been even 10 or 15 years ago when the world didn't pay as much attention to equity and access.
Great. Well, thank you. This has been a fascinating panel. I learned a lot. I hope that people who listened in have learned something on a little insight window on how journalists have been getting the stories we've been getting and the challenges that we've been facing and what we're planning to do going forward. So I want to thank all three panelists for really fascinating points, and all of the listeners for some great questions.
Thank you, Faye. This has been fun.
This was fun. Yeah. Thank you for having me.
All right. Thanks.